Okay, well, thank you for joining us. So, for those of you who don't know, I'm Alex Thomas. I'm a board member on the Graphic Medicine International Collective, and I'm happy to have Annika Mengwall today joining us for an interview. As you may know, my interest in comics has to do with educational comics. And so, Annika gave a lightning talk at our conference in Toronto this year, and it blew everyone's mind. And so, I was really eager to talk to her a little bit about her project and about how she got interested in both healthcare, comics, and graphic medicine at such a young age. So, without further ado, Annika, thanks for joining us today.
Hi, thank you so much for having me. Introduce me. So I'm Annika. I am currently in my senior year of high school. I'm an EMT, so I started getting involved in EMS in my freshman year of high school, and I've been doing that now for a while. And then I love art. I've taken art also all throughout high school, and I've been trying to find ways to intersect those two interests. And one of them was through graphic medicine, which I've just started my project, which is focusing on creating a comic that addresses bystander CPR and tries to promote bystander CPR.
That's great. So, I mean, what I remember from your your talk is that when you said that you became an EMT, you were 15, or how old are you when you became
Yeah,
EMT?
well, you can in Connecticut, you can be an EMT as young as 16 with your parental consent. So
Yeah.
the EMS in the town where I live is actually staffed mainly by high school students, and they allow you to take EMT class during your sophomore year. So you can start riding along on the ambulances in your freshman year of high school, and then sophomore year you take EMT class. So it's like 150 hours, same course as every other EMT. Take the exam, and hopefully you pass it, and then then you can start practicing as an EMT as young as 16. And
That
then
is amazing.
yeah, and then after once you get your driver's license, you can, if you have your license for 6 months and have a totally clean record, you can also start driving the ambulances. So
And you started driving at like 17, right? The ambulances?
yeah, yeah. As soon as 6 months after I got my license, I started training on driving. So
I feel like that part, if watching the video of the talk, it brought audible gasps from the audience. They were like
yeah.
so impressed with that. So that's great. So I mean, so you really have been involved in kind of emergency medicine and that kind of level of healthcare from a young age, and you still are so young. But I guess in the process of doing that, you already kind of were noticing maybe some deficiencies in education or places where you felt like some of the stuff that you were learning, through the practice of art and comic making could be helpful. Why don't you talk just a little bit about that?
Yeah, I mean, I got introduced to the field of graphic medicine actually through us doing a summer program, and I heard MK speak, and she was introducing us to using comics sort of as a almost therapeutic way means for like healthcare workers. And I started kind of drawing comics in that sense, but I hadn't had any like cartooning experience. But then I started making all those comics and I fell in love with drawing comics. And I just thought that the storytelling was really effective and they get people's attention. And then in EMS, I noticed like there's just a kind of a lack of bystander involvement a lot, and a lot of like nerves and things when especially in cardiac arrest situations, out of hospital cardiac arrest, like bystander involvement is so crucial. And there are many stories of success stories about bystanders when they get involved and the patient has a positive outcome, and then sadder stories about there's a lot of bystanders available but they don't get involved. And I was thinking about ways to maybe comics, just seeing how much they get people's attention, if they could help get people's attention towards this issue of bystander CPR. And I'm also a CPR instructor for the American Heart Association, kind of through my EMS organization. So in that too, I started realizing that comics could be an educational tool. Um,
Mhm.
so that's why it prompted me to kind of mix it all together.
So I was actually just looking it up to make sure. So there's another cartoonist physician who actually was at the conference this past summer, Nathan Gray, who recently, I don't know if you saw this, but he made a comic about kind of some of the misconceptions about CPR and how in like pop culture we assume that CPR will always work and always kind of save someone's life, even if when it's done in the hospital and things like that. But it sounds
Mhm.
like, from your experience, it's the bystander part of it that is the crucial part. That you have kind of a narrow window of time where CPR can be, potentially effective, and even that's not like a slam dunk that it's going to be
Yeah.
life saving.
Yeah. I mean, um, out of hospital cardiac arrest is a very scary thing, but it is reversible, in theory. So, but it's like crucial for those patients to get CPR in a very short amount of time. And I know in the town where I live, it takes us about 7 minutes for EMS to get there, and it takes 8 minutes of the patient being down for them to have irreversible damage and even death. So, once we get there, if no bystander CPR has been provided, it's pretty difficult to get them back. And even like you don't even have to do breaths, like just hands only CPR can make a big difference just in keeping the heart pumping, just so then we can get going on them when we get there. But yeah, I think that it is very important. Yeah, I've seen a lot of instances where people know about CPR, but I think that when the time comes when you really have to do it, I think people get really shocked, and it totally is understandable. It's a scary moment. Um, but I just am trying to I think that comics could be a way to kind of get people to get over that shock factor maybe beforehand, and kind of think about and be able to be more calm and understand that they can do something, even if it doesn't work, it's worth trying.
Yeah,
um
yeah, sure. And so, because I think that's an important point that like so much there's so much CPR. Well, I guess there's a fair amount of CPR training that occurs in lots of different workplaces as part of kind of the standard. If you're in childcare or things like that, or obviously healthcare. But I think, yeah, there is like a little bit of a disconnect where like you go through the class and as an instructor, I'm sure you see this. Like, do you feel like there is like a little bit of a disconnect where people maybe don't think they're actually going to use it ever, or maybe does it
yeah,
click in when it actually happens in the moment?
yeah, definitely. I think that, I think there's a lot, and I also even see it in my own high school CPR class.
Hmm.
Like, we have to get certified, like part of gym class, one of the semesters you learn CPR, and like everybody, like they learn it, and they know that it's a thing, but just the thought of actually having to do it on a real person in a real emergency doesn't seem to hit the way that it needs to,
Yeah.
in my experience in EMS. And then I think, yeah, I also in teaching the life support classes and different CPR certifications, like offices and workplaces are always reaching out like, hey, we all need to be CPR certified. And I think that they want the certification, so then they are CPR certified. But I don't know that sometimes it feels like they're just there to check the box and have the
Right.
certification, and not really there to like understand cardiac arrest. And you even see it in like how often people say like, oh, they had a heart attack, and like it's cardiac arrest and a heart attack are different things.
Yes.
Heart attack can lead to cardiac arrest, but like I
Right.
think even my own mom all the time, no offense to her, but she's like always like, oh gosh, she's having a heart attack, or you have a patient that has a heart attack, and like a key part of CPR class is learning the difference between the two. And so you kind of can tell in that if somebody is certified or really understands it.
Yeah, yeah. So then going back to this idea of encouraging, bystander CPR. I mean, one of the aspects of comics that can be really useful in its use in healthcare or health education or in other forms of graphic medicine is that it can be very it can destigmatize different things. And so it seems like in your comic that's part of the goal, that is trying to kind of make things maybe less scary but also like more practical, like this is what's happening, and let's go through how an actual experience of an event as a bystander would be.
Mm-hmm.
And is
Yeah,
that something that you kind of thought about when you were wanting to create the comic?
yeah. I think that the materials that already exist for that are in CPR courses are like, they do a great job teaching all the steps. I don't want to change anything about that. I'm not, trying to, like, I don't want to teach people CPR. I think with the book, I want to change their attitude towards it more. So that's like kind of where I see comics, like the destigmatization and kind of just like empowerment in readers is what I want to use the comic for, because if people want to learn CPR, they can take the certification course, they're going to learn it. But I
Yeah.
think finding the confidence in themselves, I think that like giving them a narrative story to follow along and giving them characters to relate to. And yeah, I showed my draft so far, but I had to a friend, and they were like, I know it's messed up, but like now I kind of want to try it, like I feel like I can do it. And like that's when I was like, okay, like maybe these are really gonna work, that the comic can get
Yeah.
people to be like, wow, I can do CPR, even
Yeah.
beyond just knowing the steps.
Now, one thing about the comic also, like you said, the narrative aspect of it, I think, is really great because it's not just like a didactic, like, definition diagram kind of thing. Although there's elements where you do incorporate, some more, like anatomy and things like that that are actually very important and like scientifically accurate. But then there's also like, yeah, like you said, there a story where you're actually going through someone's experience. And part of that, which I thought was really cool with what you're working on, is that you have like thought bubbles as well. So the characters are also like there's like an internal kind of thought process going on where you can kind of feel like you're experiencing it, not just watching someone do it passively.
Yeah, I think that those thoughts, I like the use of thought bubbles. That's something unique to comics, obviously, is like when you're reading it, like you're thinking it. You can't help but not think it if you're reading it. So I have like one panel where the character is thinking like, thank goodness I know where the AED is. And I think if somebody thinks that, they're gonna be like, do I know where an AED is? Or,
Hmm, hmm.
just thinking like singing a song to get the beat of the compressions right, and like hearing that song and just remembering those little thoughts are just like the most powerful thoughts, because you even just be like, I can do this, like I know what I'm doing, I can do this, it's totally something in my capabilities. um if they read it and they think that, my hope is that like if they're in the situation, those thoughts will arise again.
Yeah.
Yeah, so like getting people to believe in themselves and to consider things in a more serious way.
Hmm.
I think that's what comics can, yeah, they can really spark those emotions and thoughts.
Yeah, I think that's a great point because one of the things that always comes up, in the work that I do as well is like, why does this thing I'm making, why does this educational thing have to be a comic, or could it be a video, or could it be a pamphlet, could it be a poster? And I keep coming back to like, yeah, there's elements of the language of comics that are very specifically helpful in terms of transmitting very useful information. And I think
Mhm.
that it can get lost when for example, when you're watching a video, you have no control over the pacing of it. You're just kind of passively watching the video. Whereas with the comic, you can read, you can flip back, you can kind of linger on a panel as long as you want to. But then also, like you said, with thought bubbles, there's like a whole other layer of understanding that can be kind of applied when it's most necessary. So like what you're saying, and then that AED example, it's like um, I feel like it's more meaningful rather than a bullet point that says remember where the AED is, to instead see a character who says thank goodness I know where the AED is, because it brings the emotion of like that relief, and then also the anxiety of the reader being like, oh my gosh, do I know where ours is, and where I work.
Mhm.
So I think that internal monologue when you're kind of living through a character's experience is so useful. And like you just don't see it very often in like purely like educational content, and that's where like the narrative aspect I think can often be neglected. But I think like your comic is a great example of why narrative and storytelling is important even in like educational materials, and not just kind of like
Mhm.
works that are a fiction that don't have a specific educational goal. So
Yeah,
that's really cool.
thank you. I think that there is a lot of visual material, I think, that already does exist about, CPR, and there's tons of graphics, and the entire CPR courses that I teach, they're driven by videos and watching people do things. So like the idea of visuals is implemented heavily, and like all tons of posters, pamphlets you can buy, you can hand
Right.
out. Um, I just like think that I, at least I personally haven't found a story of like a fictional story of the characters kind of like going through and having a happy ending. And not to spoil it, but I think that yeah, the whole thought of having characters that you can relate to and connect to, and also making them memorable. I think that like caricature of cartoons adds another level of detachment that also makes it so that people can attach more, because like you feel a little bit more, like to have a funny looking character that you remember, and has like a funny name. And I think that's where I see also in your comic and Iggy and the Inhalers, and like that the use of characters and like the freedom that you have in creating like fictional things almost makes it easier for people to imagine things in a real life situation.
Yeah,
So
no, I agree. I mean, and I think for you, like it's a little bit of both as well, where you have like some characters who are very memorable in terms of like visually how they look and their name, but then I feel like the main character is almost more of a less caricature and more, I'd say a little more not abstract, more simplified.
mhm.
Um, and for me, that's always like what we try to use when you're trying to get the reader to put themselves in that position. So like they fill in the gaps and they see themselves as a character. Because I think when you go too specific for that main character, then it actually can be like, oh, I'm not that person.
Yeah,
But for you, it's like you have both. So there's a really good push and pull where like the memorable characters are there where you, for example, like and it's like with Iggy too. The idea is that if you remember the character, it's tied so closely with the information that you want the person to remember, that hopefully just by remembering the character they remember the information. That's kind of the idea that we try to do, is when we create a memorable character, it's not just to remember the character but to remember like what they embody or the lesson they were connected with. And I
yeah,
feel like that's definitely the case with your character, because it's really interesting because in I think we can show kind of one example of this, but like the usually when you see like a CPR diagram or that type of materials, they're very kind of like anatomically correct, but also kind of like boring in terms of like how they look, in terms of like the person that's receiving CPR. It's kind of like almost like an anatomy sketch kind of thing.
yeah,
Um, or when you have like a comic that's like a narrative comic, you have characters that are drawn, with more style and a little bit more kind of like comic style proportions. What's really cool about yours is that they overlap. So like you have this character who has like a more kind of cartoon like appearance, but then he goes through like a medical procedure, like medically correct, with the anatomy also being correct. It's like a very interesting thing where like I've never seen that before. It's like, imagining a kind of a comic character going through an actual, medical event. It's really interesting to see that.
I mean, I think yeah, it was definitely in terms of designing the characters, because all my artwork that I've done previously is very realistic, and I had very little cartooning experience at all. Like I actually like, I mean, I would draw little characters and things when I was really young, but ever since I've been focusing on like drawing things to be as real as they look. And so when I started drawing cartoon characters, they were really looking weird, if anything, because I kept trying, or like not weird, and cartoons kind of always look weird. That's like the point. But they were in this in between of like a little bit too realistic, but not cartoony enough. And
Hmm.
then, but I think it actually in some ways ended up translating pretty nicely, because I was able to like fit like a heart in there, even if the heart doesn't really look like a heart. But like there's a place where it would make sense physically in his anatomy.
Yeah,
I think it was, I also didn't want things to be too realistic, that maybe they're like hard for some people to look at, or
sure.
somebody, um or maybe yeah, like you were saying, like they're kind of boring, like those generic images of like the CPR dummy. Like I wanted it to be a little bit more fun and interesting, but it still had to be anatomically correct enough to make sense to have like
Yeah.
CPR done on it. So yeah, that took a lot of experimentation. But I think I'm pretty happy with where he's at
No,
right now.
yeah, I think it's great. And in terms of like art style and stuff, I would say that like it seems like you're a big fan of comics, just in terms of like the way you compose it. I mean, like the comics composition of the frames and the pacing. is like amazing. It's really like
Thank you.
astonishing, especially for if this is like your first comic book you've ever made. It's great. And so, yeah, I guess that's the other question. It's like, are you a big, are you a fan of comics? Do you read other comics? Others? Do you have favorites that you're
Yeah.
inspired by?
I think my favorite comic artist, and she does graphic medicine, although I think a little bit less now, is Raina Telgemeier and her
Yeah,
work, her book Smile. I mean, I know I picked up those books when I was like elementary school and I read them like every single day.
it's
Like I
great.
would keep rereading them. And I just loved her the way I think she also has a nice balance with her characters that they're human, like they're definitely like noticeably human, but they're also very much like cartoony, but like
Hmm.
they still like you can imagine them as if they were a real life human.
Yeah.
And I think that was important. And I also just I love the way that she does a nice job like varying the pages and not having too many panels. I think that was something I wanted to stress too. Like I like having big pictures. And I think also, especially when you're trying to convey this kind of complex medical information, like having things be
Hmm.
as big as possible is important. So yeah.
Yeah, I think it's great. I mean, I think like especially where you go into sequences of like chest compressions or things like that, it kind of changes to support that those lessons. So it almost like, there's narrative aspects, but then when it goes into more of a teaching kind of part of the story, the panels kind of support that. And so it's a great use of, I'd say, paneling, because it really does kind of change depending on the information you're trying to convey, and it works really well.
I also
Um,
thought, yeah, I thought the medium of comics in terms of the panels was especially conducive to CPR, like
yeah,
specifically, because I think a lot of it, like, when you're writing a comic, you hear all about like thinking about the beats that you need to make for every single thing. And like CPR is all focused on beats and like 30
yes,
compressions and 2 breaths and like spacing everything out and like all the different steps. It's like checking boxes. So like I thought just fitting everything into these panels, it was like asking for it. I think the CPR kind of like the way things go and the steps of them.
yeah,
I just thought it fit really nicely.
that's great. So now the $1 million question is, what do you want to do with this comic when it's completed?
Oh, well, I want it to be accessible to as many people as possible. I think I have a vision of kind of creating like a floppy comic that can be distributed. I'm still figuring out like ways I can get it. I mean, I could see it being part of a CPR curriculum, like maybe as like a extra piece of information, like something that people can be given at the end of a course. Maybe in like kind of like gym classes in high schools. I think a lot of public schools mandate CPR now. Um, and I do want it also to be accessible for kids and adults. I think sometimes adults feel like they shouldn't be reading the comic, but if anything, it's really
Mhm.
the adults that need it. So kind of an adjustments I've been making is making it like do like feel a little bit more approachable for adults, which I think probably pretty important when it comes to thinking about cover art, is what I've been thinking.
Mhm.
Um, but after it's published, yeah, I just want it to be given to as many people as possible. And ideally, I would also like to do research on it and to be able to see, like, is it really effective? I think one of the reasons why I'm so drawn to graphic medicine is that it is such like a research backed field. And it kind of like takes art and it like puts science behind it, which is like so awesome to me. And I
Yeah,
want to do that for my book if it's possible, and to see, you know, how graphic medicine and how comics can really help promote CPR and if it really does make a difference. So yeah, that would be the
yeah,
dream.
that's great. Yeah, I mean, I think that's very attainable as well. I mean, the other thing that I still can't, downplay is you are so young and this is so far along. so, so there is so much that you can do with this and other, topics, because I think, your sensibilities are, I feel like, already so resonant and really, um, I can, I relate a lot to like the need you felt to make the comic, because part of when I made Iggy was I really was like seeing a need that I just wasn't seeing out there, and I just felt really inspired to do it, and
Mhm.
really, like, that's where comics can really be useful, because you can kind of shape, the missing puzzle piece exactly as you need it, and then it fits perfectly.
Yeah.
And so I feel like this is one of those things. I feel like this is one of those perfect fit scenarios where this is like something that's missing that is exactly what people need, and I think once that happens, all of the stuff will follow. And so like in terms of research, like when so I don't know if the viewers may not know this, but like I started drawing Iggy the Inhalers when I was like 11, and then also worked on it in high school. So like we were very similar in terms of like working on stuff through high school. And then for me, I just kept updating it, and then as I went further in medical training, I'd update it, and then eventually it kind of got to the point where people were doing research for it. But for me, early on too, I was like, how do I get this researched? And
Yeah.
that's like,
That's
and it's because you as you kind of mentioned, it's comics are very a medium, and graphic medicine is a medium that really could be supported by research, and research can kind of show the effectiveness of things if they're effective. But yeah, it's kind of hard when you're not connected to that world to like to do research. So I would say any kind of like research like project that is available like in school, you can always do like um, pre and post like knowledge testing. That's usually like the first way to start, where you maybe start with like a questionnaire, and then have them read the comic, and then do it, and then do this same questionnaire afterwards, and see if there's an improvement of knowledge. You can also do like, especially for a comic like this with some of your goals, more of like a qualitative study in terms of like attitudes about CPR, and seeing how like how more likely are people to be less reluctant to do bystander CPR in the event of it. Um, and like, and I did that, in my own like small scale the way I could, and then eventually a university will be like, we want to research this, and then that'll happen because there's plenty of people who are looking for educational materials, and then they also want to be able to do that research. And I'm sure there's going to be some great research projects around this comic, and so I think it's just a matter of like keeping it up, and when you are able to trying to do it on your own. But otherwise, the bigger institutions with infrastructure,
Mhm.
no doubt will be interested in something like this, especially in emergency rooms and schools and things like that. So, and it'll be cool because I think that once, yeah, and that's the other thing, piece of unsolicited advice I'll give you is that, especially with early research, if you may be surprised, because I know I was, early on, where like there's something that I really liked that I thought was really clear, and then the early research showed like, oh, there's a one point that people are missing, and so especially early on, it's definitely also not a bad idea to like revise and things like that, because that's kind of how you perfectly make that missing puzzle piece exactly fit. And so that's something early on that's always a good thing to do, because there's sometimes things where just as the creator you may not see a blind spot that others may, and that's also helpful to do. But yeah, I think this is great.
Thank you.
And that brings me to my next question, which is, what do you want to be when you grow up?
Right now, I really want to be an OB. I'm
Hmm.
super interested. I want to be a physician, um, but I also don't. I don't know. I'm keeping my options open, but the dream has been to work with women and to help them and work with babies. And I think that in EMS, not that you can really have like a favorite call, I think,
Yeah.
but the ones that are always most intriguing to me are obstetrical calls and
Hmm.
problem solving also with infants. I love working with, like, I just think they're very delicate and also so cute. But
I mean,
then
yeah, that's great.
yeah, and so that's kind of my dream, but I think I've also been trying to figure out ways to figure out how to be a physician and an artist, which is what you do. Um, so I definitely don't want to let go of my art, and I love creating and I love doing art. And I think that I like last year, my junior year, I took AP art, and my whole investigation was um, trying to find ways to mix art and medicine. And there was nothing cartoony about it, really. but I think that was like another way that I found way to kind of tie together these two interests. But yeah, I don't know.
No,
I
I mean, I think that's great. I mean, I would say, your exposure to medicine is already so much deeper than most people your age. And so I think that even having an idea that like you enjoy OB from like your actual clinical experience is like pretty amazing that you already know that.
I'm
So that, I
lucky in
mean,
that sense. Yeah.
yeah, that's great. And so, yeah, and it's not just me. There's many, there's many physicians that are cartoonists out there, and I think graphic medicine has definitely like brought us out of the woodwork a little bit more. So it's definitely possible, and there's a lot of great examples of physicians and other healthcare providers that are not just able to draw comics, but they use comics to enhance their medical practice in terms of like the quality of care that they provide.
Mhm.
And I think that that's an important part of it too, is that the comics that I make, are helpful for, the readers who are not my patients, who, are just people out there who are reading the comics. But then also, like, as a physician, I think being an artist, I think makes you a better physician, if that makes sense, because I think that having that artist sensibility makes you a better listener and communicator. And I'd say, 80% of medicine is just that, and the 20% is the medicine part of it. And so I think that, yeah, I would definitely encourage you to do both. I think it's possible. Now there may be times where you have to spend more time doing one over the other, and that happens. So I definitely had a few year period in residency where I wasn't producing much comic art that was very usable besides kind of personal stuff. But that changes too, and so you can make your professional life any way you want it. And I think we need more physicians out there who are artists, so I definitely want you to do both.
Yeah, I think I've always been super interested in the way art can also enhance empathy, especially in care providers, because I think that's something that, in medical school is extensive amount of education, but it's so hard to teach people to really empathize and connect with people. And I just think that art does it without really saying anything.
Yeah,
And yeah, I think that's like figuring out kind of like how art can help providers and patients, beyond just comics even too, has always appealed to me. But right now I'm loving comics.
yeah, well, that's great. I mean, yeah, we're so impressed with your work, and we look forward to kind of what you have ahead. And yeah, is there a place, anything you'd like to plug, or a place we can kind of see your work or anything like that?
At this point, I don't have anything, but I'll keep you updated on that.
Yeah,
Um, yeah, I'm working. MK has been nice enough to offer to help me too, and finding possible grants and other research like opportunities, and kind of just taking the next steps forward, because this is totally like an independent project. So I think I've been feeling a little bit stuck sometimes, but
sure.
I'm working on getting it going and continuing it, and trying to find ways to like officially get it out there. But as soon as it is, I will be sure to publicize it as much as I can.
Great, great. Well, we'll definitely be keeping an eye on you and sharing your work as soon as you share with us. um, Great. Well, Annika, thank you again for having the time to talk with us today.
All right.
We'll have a couple examples of the work here that folks can look at, and then yeah, as soon as it's ready to be seen, we'll definitely share it with everyone as well. Um, and yeah, best of luck with everything else, and yeah, keep going. That's my only words of advice, is just don't stop.
So much.
All right, take care. Have a good rest of your day.
Bye.